Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
So I welcome one and all in this class tonight on HRT and HRT made easy. So I am going to be talking about all the principles of HRT, okay, including the kind of HRT that you give in which individuals and how to go ahead and give them what should be the dosage schedule, what should be the timing, what should be in which situations should we give, should we not give, what should be the preliminary investigations, the basics that you need to know. And HRT is oft repeated topic in exams, isn't that right? Now, I want everybody, first of all, to be active in the chat box so that I can see what my students already know about it, and that makes a fun lecture. Okay, so even when I was studying as a student, if you just pick up a topic and you start studying it, it becomes dry. What you do is just focus on the heading and try to recollect as many topics, as many points as you can from that heading. For example, let's say investigations. Okay, so investigations, try to remember all the investigations you can and then see the ones which you did not mention. So things become very lively, easy, and the topic becomes very interesting. Okay, sometimes it's a new topic, but it's not that you don't know anything about any topic, right? So you can always give a guesswork, DD. Try to give DDs. Maybe you'll be able to finish maybe 4-5 DDs and there were 15 of them. So it's fine, no problem. At least 5 you knew already, and those 5 will always stay with you. You'll never forget them. And another 5 out of 15 you will learn, right? So that makes your studies easy, fun, and also time saving. With that thought in mind, let's begin with HRT. Everybody who's not there in the chat room, please go back to the main Telegram group. Join through the pinned message. You will enter my chat room automatically and try to answer the questions that I'm going to ask you. So the first slide, the first question. What are the indications of HRT? Quick. I want these indications from all of you, and then of course I'm there to tell you how and what happens. Why do we give HRT? Start writing, all my lovely students who are there, who thought that is going to be a walk in the park. You all know the indications, but it's just that you need to be quick in letting me know. All right, it can be interactive. I can unmute you people as well, but then it will be a more chaotic session. Good will be if you can just answer me in the chat room, and I'm sure people like Pragati, Arsh, okay, Pooja, I'm expecting from you, Shraddha, AK, Nisha, Meghna. These are all my old students. You've got to be, fast in replying me back. So let me see what you have written. So yeah, let's see what all have you got. Yes, absolutely. So all the postmenopausal symptoms like the vasomotor, what do you mean by vasomotor symptoms like hot flushes, sleep disturbances, urogenital problems like itching down there, dryness, urinary, there's always that itch inside and you feel that it's a urinary tract infection when it is actually not. It gets okay with urogenital, this estrogen creams. So urogenital symptoms, loss of libido, right? So all these are indications for very good Pragati for HRT. So both vasomotor symptoms, it's very effective treatment for vasomotor symptoms, right? Genitourinary symptoms, that means I'm talking about vulval atrophy, dryness, dyspareunia, UTIs. Hypoestrogenism, that means all the effects that your ovaries, because your ovaries have not been working now, so the effect of bone disorders or cardiovascular disorders or bone growing fragile, they are also managed by the HRT. Osteoporosis prevention, yes, these are the indications of menopause, the HRT. Correct? Menopausal hormonal therapy also it's called as, right? Next question. Can you tell me the absolute, I'm not waiting for relative contraindications. Can you tell me the absolute contraindications of HRT? Anyone in which you will definitely not give the HRT? Come on. Let me hear what my students have to say. So I will, very good Ash, very good Shraddha, very good. I'm very, very proud of you. Fatima, I am expecting from you as well. Everybody can try. You can be wrong, no problem. Agastya is there. Pooja is there. Come on. Who else is there? AKAM. All right. So these people, come on. You can answer. So you have a few absolute contraindications in which you will not give HRT. Can you tell me those? Okay, and the answers are already there. Breast cancer, active breast cancer. The patient is currently on breast cancer treatment. All right. Even better, past history, past present history of breast cancer. Family history of breast cancer, is it? Is it a contraindication? No, it is not. Until and unless you know that it's a BRCA gene positive, it's not, right? Active past DVT, VTE, venous thromboembolism, agreed, absolutely agreed. Undiagnosed vaginal bleed, absolutely correct. I was waiting for this. In fact, it's the first indication. Undiagnosed vaginal bleed, please do not give. Yes. Okay. Let's hear it what we have to say. So these you have to remember. The absolute you have to remember. A relative is very interesting, which is why I have included it in the list. Unexplained vaginal bleeding, active liver disease, current active liver disease. Disease I'm talking about, not a derangement in the liver function test, but active liver disease. Breast cancer, current, past, suspected, everything. It is a big no. It doesn't matter. Triple positive, triple negative, doesn't matter. No estrogen positive, negative state, nothing. Just no. Coronary artery disease, any cardiovascular disease, coronary, especially coronary artery disease, MI, stroke, thromboembolic effects, no. Endometrial cancer, suspected, present, past, no. Okay. Now, coming down to relative contraindication. Now, I used to think that a patient who's very obese will not give HRT to. A diabetic patient, hypertensive patient, hyperlipidemic patient will not give, but it is not a contraindication. It is a relative contraindication, and transdermal do very well with such patients. Smoking, alcohol, not a contraindication, just a relative caution. So in these patients, you will do the transdermal patch of HRT rather than going in for oral HRT. Are you with me, guys? Because all these conditions will lead to high, chances of venous thromboembolic effects. So you will give transdermal rather than oral. Endometriosis, fibroids, benign breast disease. Again, all of these are relative contraindications. The family history of cancer, family history of diabetes. Again, I said these are all relative contraindications. A very, very important, table, guys. Very important table. Okay, so can you please tell me the contraindications once again? It is undiagnosed vaginal bleed or present cancer, endometrial cancer, past, present or suspected breast cancer, venous thromboembolic effect, past, present or suspected, active liver disease or any coronary artery disease, MI, stroke, cardiovascular event. No. Right? Obese, hypertensive, dyslipidemia, diabetic, endometriosis you can give. Smoking, alcohol you can give. Am I clear so far? Am I clear so far, guys?